regarding L4, L5 disc bulge or L5S1 disc bulge or any lumbar disc bulge problem. In this video, I'm going to answer 4 commonly asked questions that I get asked on my video about L4, L5 disc bulge, specifically regarding exercises. And these are the 4 questions I'm going to answer. So stay tuned till the end of this video to get all the answers. I'm going to answer: how many times do we have to perform these exercises in a day? How many reps should I do and how many sets? And should we do the exercise in a particular order, or can we do them randomly? And last question in this video I'm going to answer is, do these exercises cure the disc bulge, or is it only for temporary relief from pain? Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way. Hi there, this is Dr. Walter Salubro coming to you from Vaughan, Ontario, Canada. I'm a chiropractor here in Vaughan, Ontario, Canada, and my office is called Back to Health Chiropractic Center. And many people come to my office because they've tried a lot of other options for therapies when it comes to chronic conditions, whether it's a disc bulge condition, a back pain condition, a leg pain, sciatic pain condition, and these other therapies unfortunately have failed them. So they come to an office like mine looking for corrective chiropractic care. And that's what we do in our office. So we've helped many people overcome chronic ailments and back pains and other spinal related condition through corrective chiropractic care. If you're a regular follower of my channel, I want to thank you for coming on and being a follower. And if you're new to my channel, be sure to click on the subscribe button, that red subscribe button right below, and also click on the notification bell. Like this, you don't miss out on any of my fresh new content that I put out on tips and strategies and even exercises and how to relieve chronic pains and how to alleviate discomfort, alleviate stress, and also show some protocols and corrective chiropractic care that has helped many people overcome their chronic spinal pains. So you may have seen my video on the best exercises that I think are helpful for L4, L5 disc bulge, and I'll put it right up here in the card. And if you haven't, be sure to click on it because I've received a ton of questions. And comments. Over 1,000. I can't even moderate all of them and answer all of them. So I'm going to answer 4 of the most common questions in this video. And you'll see that this is the video that I'm talking about. Best exercises for L4, L5 disc bulge and for L4, L5 disc herniation. And I go through a bunch of exercises. So you can look at that video. I'll link it in the description below. And you'll see all the comments and questions I've been getting about this. And I want to clarify some things, because I think it's very important to get to some of these important commonly asked questions. Okay, so let's get started with these questions. So the first one that I'm going to answer is this, is how many times do I perform these exercises in a day? And it's a very good question to ask. And there's really no wrong or right way to do it, but ideally I would say that you should perform them at least once a day and preferably twice a day. So if it's once a day, it's a good way to start your day in some cases in the morning, or maybe a good way to end your day before you go to bed. But ideally, it would be better to do it twice a day. Once in the morning as soon as you wake up, and then once in the evening before you go to bed. And that's what I'd recommend. That's what I tell my patients, is to do at least twice a day, once in the morning and once in the evening. Okay, so the next question is, how many reps do I do and how many sets do I do? It's a good question as well. So some of the exercises you'll see are mobility exercises like the mad catch or the pelvic tilting exercises. And one of them is stretching exercises, and then one is an extension exercise. So the mobility exercise ones, you can start with 10 repetitions and then work up to 3 sets of 10 repetitions. So it's 30 repetitions. 3 times 10, 30. So 3 sets of 10 repetitions. The stretches, the knee to chest stretches, what I tell my people is to hold the stretch for 10 seconds and then do the stretch 3 times, each knee and then double. The extensions, you can start with maybe 3 or 4 or 5, just get to comfort level and then work up to 10, even 15 or 20 to your tolerance. Remember, it's always done to your tolerance. That's a key factor. People ask me sometimes too, is, I feel pain or discomfort after this exercise. Well, you test it out, test your tolerance, and if it continues the pain, then you don't continue the exercise. It's that simple. Not every exercise is specific for every single person. This is just general information. I don't know exactly what your spinal condition is like. I don't know exactly what your clinical presentation is like. Your doctor would know that, and your chiropractor or therapist would know that. and they'll be more specific to tell you the exact recommendation that you require. But these are general recommendations, general information, and no one should ever continue through an exercise unless if it continues to persist and cause more pain during the exercise and especially after. Okay, so I hope you're enjoying these question and answers, and let's continue on with L405, L5S1, disc bulge related conditions and questions. The third one on this video here is this: should we do the exercise in a particular order, or can we do it randomly? And it's a really good question. I personally like the order that I presented in the video, starting with the mobility, which is the Mad Cat, and the pelvic tilt, and then going to the stretching and then the extension exercises. Some people may want to start with the pelvic tilt. It's a little easier than the Mad Cat mobility exercise, but certainly I would start with the mobility regardless, and then move into the stretching, and then eventually into the extension. And then if you're doing other forms of exercise, you can always add core work afterwards. But I'll get through these basic stretches, these basic exercises in that particular order. So mobility first, then stretching, and then the extension. Okay, the last question that I get asked commonly is this: does the exercise cure the disc bulge, or is it only for temporary relief from pain? And I can understand where someone's coming from. They're frustrated. You may be frustrated with your back condition, with your disc condition, with leg symptoms. You may be frustrated with the fact that you've had to go through a lot of assessments and MRIs or done tons of therapies that have failed you. And I kind of get that. The truth is, I don't know if it's going to cure the problem. I just don't. I don't think any doctor can predict that. So that's why we don't use the word cure. These are general information, general recommendations of exercises, and they may provide some symptomatic relief or alleviation of pain. They may, and in some cases, some conditions are just so chronically degenerated and very advanced that they may not provide any relief. And I've seen that, and it's unfortunate. And what I know it may require some professional work, some professional corrective chiropractic work, for instance, which is the kind of work that I do in my office. May require some other forms of therapies under the guidance, like for instance, of a physiotherapy. May require some soft tissue work along the muscles in the forms of massage therapy. These are all co-management options, but certainly if there's a spinal structural disorder or dysfunction, corrective chiropractic care in general is very helpful for that. So these are just some general guidelines, some general stretching and mobility and extension and exercises that if something is really chronically and it's advanced with degeneration, especially with disc bulge and disc injuries, it may not cure the problem, but it could possibly help alleviate it. And in adjunct with professional work and professional care, such as corrective chiropractic care, will be a very good component to do at home in conjunction with some professional work. And I did have a video, and I'll post it up here as well, where I talk about can disc bulge be cured and how long does it take for it to heal. So I'll post them up here and also in the description below. So there you have it. Those are the 4 questions I wanted to answer regarding L405 disc bulge and the exercise video that I showed you earlier. And I am going to have a series of videos. This is number 1. So I'm going to have a series of videos that will answer commonly asked questions related to disc bulges and what can be done about it, and basically get through these questions that are most commonly asked. So look out for these series of videos coming up in the next several weeks, and you'll find it in a playlist as well. Thanks for watching. If you ever have any questions, leave them in the comments below. I do my best to answer each individual questions or through a video like this. If you enjoyed this, be sure to hit that thumbs up button. If you didn't like it, I'm okay with that too, because I want to always improve on my videos. So tell me what you didn't like about it, and I'll do my best to change and improve and make it better for you and your experience. And if you did like it, share it with a family member or friend. Be sure to add it to your playlist, and don't forget to subscribe, because it tells me that people are interested in this content, and I can put out more valuable content when I see more and more people are interested. And hit that notification bell. Make sure you click on the notification bell so you can get instant notifications on my new videos. Thanks for watching. I'll catch you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.